Was that off all along? I hope not. All right. Let me share for... Hey, 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 how are you doing? Joanne, Malik. Is it my glasses? I guess probably needs cleaning. All right, hope you are doing well. I'm winding down. It's time. No, don't put on my glasses. It's soon time to go to bed. Soon time for me to go to bed. Did I put that on public a while ago? Yeah, let me just check something. And I said, let me just come and, I was going to do a video a while ago. And I said, let me just come and just talk to you guys. All right. Let me just come and just chit chat for a minute and then I'm done. Okay, so it's up. Hi, hi, hi. Remember to go ahead and like up the live. Thank you for joining in. I appreciate you taking the time out. All right. So I was gonna talk a little bit about high yielded NCLEX questions. Some of them that you definitely cannot miss. Hi Tyrone, how are you doing? So I'm just going to touch on that a little bit. I'll go through a few questions because we know the high yield questions on the NCLEX are going to be surrounding your GI system, your cardiovascular, neuro, and maternity. So those are the focus area for, you know, the NCLEX itself. So if you focus on those areas, look at your prioritization, delegation, things like those, you should be all set when you're, you know, studying. So when it's, oh my God, why people always decide that this spam call is killing me. All right, you can go to voicemail. So yeah, remember to go ahead and like up the live, share the live. Did I share it? I think I share it. Yeah, I think I share my live. Remember to just go ahead and share the live. You can give the video a thumbs up and also do your daily heart me. You see this little heart up here? Yeah, click on it and there's gonna be a few things that you have to do. All right, definitely do that. So when it comes on to your high yield questions, some of the examples. So for example, you have a safety and priority question. Hi, why, Coach Man, welcome. And welcome everyone. Thank you for tuning in. If you're new here, I'm Stacy. I'm a nurse originally from Jamaica in the States here. And we're doing, you know, we do NCLEX questions at 7 p.m. on Tuesdays and Thursdays. And I'm doing random pop-up videos as well on, you know, at 7 p.m. So you can always pop in and be a part of the team. I remember to go ahead and follow as well. And you don't have to be a nurse to be a part of the ThinkNursing family here. All right. Just go ahead and follow, subscribe on YT as well as on TikTok if you're there. The handle is the same. It's the same ThinkNursing. All right. All right. So when it comes on to your safety and priority questions, there are questions that might look like this. A nurse enters the room and finds a client on the floor. What is the first action of the nurse? All right, and the options you'll have is to A, check the client's vital signs, B, call for help, C, assess for injury, D, notify the provider. The answer is gonna be C, which is to assess for injury, because always start with the nursing process. All right, so you think about your assessment, diagnosis, planning, implementation, evaluation. Always look at your question and say, okay, you're gonna assess, and then from there, you know, you look at what the question is saying. So the first step is always to assess before taking any other action, and always follow the nursing process, which is the ADPI. All right. You might have a pharmacology question that looks like, you know, a client taking digoxin has a serum potassium level of 2.8, which we know is very low. And so what should the nurse do? All right, so if you have a patient with digoxin and the serum potassium is 2.8, it's low, we know what digoxin does. So definitely you'd want to go ahead and withhold that medication and notify the provider. So you want to go ahead and replace that potassium before you start administering your digoxin. All right. So hypokalemia causes the risk of digoxin toxicity. So that can cause bradycardia as well as visual changes. So always think about your lab values that are associated with your medications. You also think about your vital signs as well, because if you have a metoprolol, a beta blocker that needs to be administered, you know, you definitely have to go ahead and check your heart rate or your vital signs. So always look at the medications, what system they affect. Also look at, you know, the lab values, and you know, you go from there. All right, no problem. Hi, Goku. Thank you for tuning in. Fire Kush, thank you for the heart, me, and welcome. Remember to go ahead and tap up the screen on YT here for me. Just give the video a thumbs up, a like, and you can also subscribe. All right. In terms of infection control, you might have a client that they say is on airborne precautions. You have to know about the different precautions and what PPEs you wear. All right, so if you have someone that has that is on airborne precaution, you're thinking about what? Your N95, you know, your gown, your mask, your glove, okay? So which client requires airborne precaution? Is it A, C. diff, B, MRSA, C, tuberculosis, or D, RSV? And definitely we know that the tuberculosis patient, you know, is gonna need airborne precautions. Anybody that has like your herpes, you know, chicken pox, measles, you know, all of those patients require airborne precautions. So always remember to wear that. And as I say, NCLEX is all about you thinking critically. It's all about you thinking about safety. Safety of the patient and safety of the nurse. And that's it. All right. So every question you see, always go ahead and say, you know, what should I do first? Look at safety, think about safety, and then from there you answer your question. All right, in terms of maternity, you can always get a question looking something like a postpartum client. So then the complaints of difficulty breathing and the chest pain. What should the nurse do first? All right, so if you have a patient that is having difficulty breathing, what should the nurse do first? And as I say, always start with assessment, the nursing process. All right, so always assess. You realize the patient is having difficulty breathing. Always go with your ABCs. You can't go wrong with airway, breathing, and circulation. All right, so the patient is having difficulty breathing and chest pain. What should the nurse do first? You look at the options. You think about your oxygenation. So depending on what the answers are, the options are, always choose something that has oxygen with it. All right. So you want to go ahead and apply some oxygen via the face mask because you're suspecting any form of pulmonary embolism. All right, something that is life-threatening. So airway, breathing, and circulation always comes first. All right, remember to go ahead and tap up the live, guys. I see 5 persons. Tap up the live, man. Tap up the live. All right. Hey, Marvin, what's up? And that would have been the answer. All right, so always think about airway, breathing, circulation. Always think about your ADPI, your nursing process. Assessment, diagnosis, planning, implementation, evaluation. And that's what every question, when you look at it, always just be using those as a guide to answer your question. All right. In terms of mental health, you might have a patient that is having depression and they say to you, I just can't do this anymore. You understand? What's the nurse's priority response? And always look at the keywords. The answer is going to be like, you know, asking directly the client if they have any plan to harm themselves. Because as I say, you're always thinking safety. And that is what the NCLEX is all about. Critically thinking, you being the nurse there, pretending to be the nurse at the time of the exam, thinking like a nurse, what will you do if someone says to you that this is how they're feeling? All right. So remember, assess for your suicide risk immediately. And then from there, you put plans in place to protect the patient as well as other persons. Because if the patient is feeling homicidal, you want to make sure that you put plans in place to, you know, prevent any harm. And then you might have fundamentals questions as well. So which task can the nurse delegate to an unlicensed assistive personnel or your UAP? You definitely need to know the roles of your support staff, all right? Because definitely you'll find questions regarding a lot of delegation. You're not going to miss it, all right? There's always going to be a question there regarding delegation. So A, teaching the patient to use an incentive spirometer. B, checking blood glucose. C, assessing pain level. D, evaluating wound care or wound drainage. Always check, you know, the one that is best for your unlicensed assistive personnel is going to be anything that doesn't have assessing, teaching, medicating. You understand? So always remember that the primary role, the nurse, they're the ones that does the teaching, the teaching, medication, assessing, things like those. All right, especially when it comes on to initial assessment, because you have your LPNs that are able to do, you know, reassessment, things like that. All right, so the answer would be to check the blood glucose level. That would have been something that your unlicensed assistive personnel can do, all right, especially because the patient is stable. All right, when you think about your high yield questions, as I say, there are going to be 4 areas that you need to focus on. And as I said before, it is going to be your GI system, your cardiovascular, neuro, maternity, because you have a lot of questions that comes from those areas. So always focus on, like, you know, your vital signs, not your vital signs, your signs and symptoms, your interventions. All right. You also want to focus on your lab values as it relates to those areas. All right. One thing that you need to do is to start learning the concept and not just, like, you know, studying the content itself. All right. So when it comes down to like medications, try to go ahead and start studying by the drug classification. Try not to study them one, the drugs them one. Like, you're not going to finish now. All right. You're not going to be prepared for the exam. Plus, you're going to be confused as well, because there's so many medications out there that you will not even get a chance to finish up them. Honestly, there's so much medications out there. So go ahead and study them by their drug class. You know what the different medications are for. So for example, you're going to be doing potassium replacement. Know what potassium is for. You know, it works on the heart, things like that. Look at the normal values. If it is elevated, what, you know, it causes. What, you know, in terms of rhythm, what rhythm are you looking for? Or the arrhythmias. Know your highs and lows of your potassium, your digoxin, you know, all of those different things, lithium and all. As I say, always use the nursing process, your ADPI, to answer your questions as well. So your assessment, diagnosis, planning, implementation, evaluation. Always use those when you're answering your question. Always ask yourself what the nurse will do. All right. And then from there, you go about with that. And as I say, prioritization, safety is always the number one thing in NCLEX. All right. So you're always thinking about what intervention will keep the patient safe. All right. So if you feel as though you're stuck at a question and you don't know how to, you know, maneuver that question, always think about safety. You understand? Just think about safety and look at the question, the options that are there. And then from there, you decide whether or not you're going to be using airway breathing, circulation. Are you going to be using Maslow's hierarchy of needs? Things like that. The process of elimination. Definitely, Mona. Thank you for tuning in. All right. So definitely use that. And as I say, you have different mnemonics that you can always use. All right. To help with studying, whether or not it is for the medications, you know, or if you're trying to understand or remember some of the side effects for medications, always go ahead and use the mnemonic, because, you know, it's going to help you. And plus, like when you're on the go, you can always have your mnemonics that you're just kind of regurgitating, you know, so you can actually remember. When you get into the exam, it will also help you, because when you're stressed out, you probably just remember ABC. And you probably write it down and not even know what ABC really stands for. But eventually, once you get a little bit calm, you will remember that it is airway breathing and circulation. You understand? So go ahead and use up all of your mnemonics as best as you possibly can to help with studying. All right. The other thing is, when it comes on to your select all that apply question, try not to overlook those. All right. Try not to overlook those. Use the process of elimination to try and answer the question. So treat each option as a true or false. All right, and then from there, you answer your question. So it's going to be 5, 6. Go one at a time and say, okay, then is this true or false? If it is true, you tick it. If it is false, you put an X and you move on to the next one. All right, and then from there. The other thing is you need to look out for the different keywords that they use on the exam. It can be first, best, priority. What else? There are so many different keywords that you need to bear in mind that they'll use, and then from there you choose your answer. All right, all of them means different things. For example, if they say, what is the first thing that the nurse should do? You're thinking about like assessment. If they're saying, what is the best, the best option? You're thinking about like priority, all right, in terms of intervention. So read upon all of those and try to have an understanding so that way when you get in the exam, you know what they're asking. And then the other thing, when it comes on to your questions, use your practice questions to help as you're practicing or preparing yourself for the NCLEX, because at least you'll have an idea of how the questions are structured. And at that time, you'll be able to see your rationale for your answer. So at least you'll be able to say, okay, I'm thinking along that line, or close to it. So definitely go ahead and use your practice questions to help you as you study along. All right. Another thing is we need to try to get into the habit of doing like mock exam. Find a little corner, put away your phone, the books and everything, and just find a few questions. It can be 75 questions, 150, and just try to do those questions, by yourself. Try not to be cheating. It's not open book, all right? So definitely go ahead and do your 150, 75 questions and see how well you do. If you realize that you're doing perfectly well, then, that's good. If there are areas where you see you're getting incorrect, always just mark those down and revisit them, review it, spend a little bit more time on it, because definitely you never get it. All right, so definitely do a little mock exam and see how you're doing, and at least it prepares you for your exam. All right, and then the other thing is, the final thing I would say regarding the NCLEX is, when you're going to be doing your NCLEX, just, try to remain calm, rest from the day before. If you never get it from the day before or the months before, the night of the exam is not the night to try to play catch up. Always just use like little mnemonics, find out the little priority tips that you have written down. Just do some light studying at that time. Do not cram, or push yourself too much on the night of the exam. And then the next day you go in and you're probably tired, exhausted, and you start getting so anxious and you mess up in the exam. All right. So just, kind of cut down on the amount of study, the textbook that you'll be using on the night before the exam. Use your little notes, your priority tips, all of those things throughout the night. And then from there, you go in and do your exam. And as I say, try and remember your mnemonics, all right? Use up your mnemonics at that time. And just remember how the exam is set up. Read upon the computer adaptive testing, all right? Because remember, the computer, it's not your enemy there, it's not going to be your enemy, all right? So if you realize that the questions are getting easier, then probably, things going a little bit sideways. If you realize the questions are getting harder, then more than likely you're doing well. All right, so if you realize the questions are getting harder, you're doing well. So just go ahead and make sure that during those times, I know sometimes we kind of feel as though, the question is a little bit too hard and we're not doing well, so we're failing. Just tell yourself that you can do it. You understand? You've spent almost 3 years, 4 years in nursing school. Now is the time that, you need that extra push. So tell yourself that you're doing well. This is what you're here for, to pass that exam, and just continue, use those words of affirmation during the exam until you finish. All right. And then hopefully you'll do well. I hope these tips were good. As I said, this is just a pop-up live for persons who saw me earlier and know some not be it yet. You understand? But it's bedtime. I'm gonna go and get a bath, and I just wanted to come and just share a few tips here with you guys before I go in. But how are you guys doing? Anything that I miss or you want to add? That goes for you too. I see you over there. So it goes for you as well. And you, did I miss anything? Mona, how was your day? Who else I see here? I see everybody. Rosemary, Wisdom, thank you, Mona, for liking up the live. Chris Cool Rave, welcome, welcome. Shiny K, So Ellen. All right, thank you for the follow, Chris Cool Ravers. Yeah, Tyrone McLaughlin or McLaughlin. I know it has McLaughlin. All right, so basically that was it in a 5. How long have I been on the live? Let's see. Where do I find that? How long have I been on the live? Oh, 20 minutes. So I need to be on the live a little bit longer. I am doing good. I am doing good. Chris School Ravers. How are you? Where are you joining in from? Who do I have over on YT here? Can you just say hello? Just say hello by tapping the live. No, it's not going to hurt, you know. It's not gonna hurt. Or just hit the thumbs up button. It's not gonna hurt you guys. You understand? And plus, I won't know you even touch up the live. I won't even know, so I'm not gonna tell anybody. All right. But thank you for passing through, though. If you're gonna be jumping off, because I know we have a tendency to do that. I don't know why. Nazi Sweetness. Here I slept early tonight of my NCLEX RN and went into exam room with confidence. I slept early the night of. Oh, okay. Because I was like, I'm confused here. Okay, yes. Well, I went to my bed, you know, the night of the exam. So I came up with my recruiting company, you know, they put us in a suite in Florida. So on the night of the exam, I told myself I'm not picking up any paper. I'm not picking up. Plus, I never really did feel like, you know, I was 100% ready. But either way, you know, I'm going to go with God on my side. Yeah, man. I went with God on my side. I'm going to say, yes, I am ready to do this exam. But I'm never really ready. Honestly, I wasn't ready. But I went in and the night, and I was just lying in bed, just looking up in the ceiling. I'm going to tell myself, say, I'm not picking up one paper. I wasn't doing it. I wasn't gonna do it. So I was there. We were in the room and we were just chatting and laughing. I had another friend who was down in her book. I'm saying, no, I'm not doing it tonight. If I never know it, I'm not going to know it again. The only thing I could bank on is probably putting the book under my pillow and wait for what? Osmosis or diffusion to take place. Oh, Lord. But I never did that. I woke up very early and I was so ready for the exam. Yeah, man, me walking at the exam and when me tell you, say, nobody never really asked me how much questions I did when I, you know, as I say, I wasn't 100% prepared for NCLEX because I was just gonna try it out. I never did like a ton of studying, like, you know, with just like all, you know, other persons are doing for their NCLEX. I guess because at the time a lot of persons were failing as well. You had a few persons from the Caribbean or from where I am. I was at the time that were failing. And so I was just kind of telling myself that at least I can go over there and see what the exam is like. You understand? But I think I studied the medications. I know my pathophys. So I think I was feeling a little bit, you know, okay with the exam. Oh, you're shut off at 85? Oh, Lord. My one never shut off at 85. My one never shut off any at all. You understand? I mean, shut off the computer. Lord. No, I did the entire exam though, Mona. All right, proudly did the entire exam. When I came out, I never really feel like, you know, I failed the exam or anything. I just feel like I am upon borderline. You understand? Because every question I had to be like, Stacy, you're in the perfect world. You're not short staff. I saw me after the exam. You understand? You're not in the perfect world. All right. So there's no other patient dying. That's how I had to be answering the question because most of the time when I was doing the exam, I was just thinking about, okay, then this is what we do in Jamaica. This is what we do on the floor. You understand? But don't go in there with that mindset. All right. I think that was the thing about, you know, the NCLEX for a lot of persons. Because they had the experience, we're going there and because we know this is what we're doing in real life, because we're running short on staff, we're running short on supply, we're just going there, we see the answer just, you know, showing up, when really and truly that's not how, you know, we're supposed to be doing it. And I did my exam, come out feeling cool and ready, you know, ready to go and shop. I never shop till me drop though, but yeah, man, I done my exam and after I pay for the one day or 24 hour 48 hour, that one, the express, I see the little P, you understand? So I say, oh, nice, ready for foreign. Yeah, man. Hi, TS Music Entertainment, welcome. Yeah, so that was it. And as I say, it's neither here nor there for me, you understand? As long as my pass, as I say, I've never heard Like nobody, since I've started working, nobody has ever asked me, how much questions did you get? And it never really affect my pay. It don't affect my pay any at all. You understand? It doesn't affect my pay any at all. So I just tell people, just go in there and do your best and come out, because even if you're, not saying anything about persons who pass at 75, it's nice to get to your 75 or 85, whatever number, you understand? But just remember that at the end of the day, it's all good of a nurse you are, how caring you are, you take care of your patient, you treat the patient as though they're your family, or that is a person, or you give them the same care that you would have wanted if you were supposed to switch role. You understand? As me say, I've never heard anybody come and say how much question you did on the NCLEX exam, because me not going to pay that amount of money. You understand? And even though I probably did all the exam question, may I start from high. I'm starting from the highest rate. You understand? When it come on to bidding. And, may I talk about my experience, may I talk about my skill. And then from there, we talk about money. You understand? So don't let it be a case where you feel as though, oh, you did the entire exam. You understand? And you can't talk about money good, or you don't feel as though, you deserve to get certain amount of money. No, man, don't do that. All right, but kudos to the people them where exam cut off at 75, 85, number one, 265. Good night to you and everybody else. I'm good. Oh, you never really asked me how I'm doing. Okay. All right. That's nice. Yes. But yeah, well, kudos to all of those folks who, the exam cut off at certain numbers and all, but mine not cut off at no time at all. You did the entire exam for LPN. Okay. Yeah, it never cut off for my NP though. It never cut off any at all. I don't think it cut off. Does it cut off any at all? I don't know if it even cut off for the NP. You understand? All I know is that when I went in the NP exam and I did it, and I was there and I felt so confident. Yeah, man, because at the last minute, there was a review that I saw. I had it in my email for a long time, printed it out and everything. And that was the email that saved me. Thank you so much for the heart puff, TS. All right, that was what saved me, because a lot of the mnemonics, that they used in that review course, I remember it. And may I tell you, so the exam full of heart sounds and endocrinology. Yeah, man, all them questions there, antibiotics. And I was able to get a hang of those for the exam. And it wasn't that bad. You understand? I feel as though it was easier than the NCLEX, I think. Yeah, I will say it's easier than the NCLEX. So that was just it. Thank you for liking up the live. Yeah, that's how I felt. I felt as though it was easier than the NCLEX. And it was the same thing again. As I say, I usually just study very, very broad, because at the end of the day, I want it to be a case where once I'm done, I can still answer questions and I feel comfortable with, talking to patients about certain conditions. So I usually study very broad. I don't really focus that much on questions. Like throughout my study, it's more of me reading, and then probably a couple 3 months before I will be looking at questions, because I'm tired, my brain tired at them time I'm ready to sit exam. So I usually just focus on reading very broad. Once I feel comfortable with the content, then I go now and focus on questions and look at the rationale. But the questions are not it's not, I don't spend a lot of time on questions when I'm studying at the initial. It's usually at the end, just to see how I'm doing, and then from there. Yeah, but to me, the NP exam was easiest. I guess probably because I never had any select all that apply question as well. But even so, with the select all that apply question, you just have to do it just like how you do the, the multiple choice, where you treat it as a, true or false, elimination, the process of elimination. It doesn't really make a big difference with the two, but there wasn't any on the NP exam. I didn't do too much questions for NCLEX RN either. Yeah, men that work at them time there. And as I say, it was this case where you had like a few persons were going up to do the exam and they were failing, and then at my time now if you go up, like yeah. So, and then at the time I was like, oh, I have, I have my little 4 years of nursing. Well, it was that, I think I had only 3 years of experience at the time. 3.5 years. I think I had probably 3.5 years experience at the time. So I felt like, the question. So the only thing I needed to focus on was pharmacology because, the medications that we used back in, Jamaica at the time, it wasn't like say much. So in terms of pharmacology, I needed to work on that. So my focus was on the medications than anything else. And then from there, studied for 3 days and went for my boards and pass. Okay, bright sparks. Which one of the exam was that? For the RN or the LPN? RN. Okay, nice. For the RN exam in Jamaica, that's a little bit different. I don't know if you know what the RN exam in Jamaica is. That one will mad you. You understand? That one is like, yeah, it's a lot because you have multiple choice, you have short answer comprehension, and you also have a practical part of it that you have to do. So at the time when I was doing it, so it's 2 days for your exam, and Jav, congratulations. Take out the sad face. I finally applied for school. She have a sad face there. No, dear. Me not going to have that sad face with you. All right, as I say, you can reach out to me if you have any question, and I will try to answer. All right. Yeah, but the exam in Jamaica, the regional exam in Jamaica is like totally different from, the exam here in the States. I think they have changed it a little bit, but at the time it was like 3 days or 2 days? Let's see. Let me check when I did my nursing exam years ago. Let's pull it up. Notes. All right, so nursing, my credentials, not that one. Nursing license, and see, this is where I store all my nursing license with expiration date, the initial date of exam. All right, and so my nursing license, I got my nursing license in Jamaica. Oh no, what am I looking for? My nursing Jamaica exam date. All right, so my exam date in Jamaica was the 5th and the 6th, 2011. I graduated on August 14th, 2011. All right, and my last nursing license expired December 31st, 2017 in Jamaica. All right. Oh. Yeah. So I try to keep them in one place because sometimes, I find out that there's so many things that you need and sometimes you can't find it. You understand? You can't find it. So I did my NCLEX on October 27th, 2015. Yeah, in Colorado. Yeah. So I did it on the 27th of October, and then I got my license November 3rd, 2015 for Colorado State. That expired in 2017. Yeah, but by them time, they are foreign long time. I was in the foreign land. All right, but yeah. But the exam in Jamaica is so much different than here. In nursing school, you have to do that practical exam where you go into the different hospitals. They select a hospital. So you have instructors from different places in the Caribbean. All right. You might have one from Grenada, wherever they are. But you have different nursing officers from the nursing council in the Caribbean that comes to sit your exam with you. And so there were 3 persons the day of my exam. They will give you an idea of where you'll go for your exam. So one of the major hospitals or one of the private hospital. And then they'll tell you, oh, you're going to be on the orthopedic floor. They not tell you which patient because we don't know what patient you're going to have on the day. You understand? Them set you up like, them set you up. And they tell you you're going to be on like the med-surg floor, the orthopedic floor. And then from there, you go in. So you have to find the time now to go in and try research on all the orthopedic cases there because any one of those patients can be yours. And if you know the hospitals in Jamaica, them overcrowded. You understand? Except if you go to the private hospital. So at the time, I went to one of the public hospitals at the time. But then the day of my exam, them tell me that, not the day of my exam, few days leading up to my exam, they told me I'm going to go to a private hospital. So you know who had to get up early in the morning and go to the private hospital? Not on the day of the exam, but a few days before. So you can actually go through the patients them now. So you go through the names of the patient, you go through them condition and the medications that they use on the floor, and just hopes that none of them will get discharged up until the time that you are supposed to be doing your exam. So on the day of the exam, wake up very early and go to the hospital. Some people go to hospital from 2 o'clock in the morning because patients are get admitted sometime. Some persons are getting discharged. Your exam is going to be at 8:30. So you want to know that all the patients on the floor, you know them condition. You create a care plan in your brain, write it down on a piece of paper, and you have all of that plan ready to do your exam. 8:30 bright and early. You see the 3 preceptors. As I say, these are persons from the region. So wherever they're from, one probably come from Trinidad or somewhere, nursing body, because it's a regional exam. You see 3 of them march onto the floor and they say, "Oh, hi, Stacy. Yes, this is Tom, Dick, and Harry. And we're going to be your preceptor for today. We're going to be invigilating for the exam." And as I say, you have to pass this board exam before you can actually even write the exam, the written exam, to get your RN license. All right. And so they'll come and they'll tell you, okay, then now we're going to assign you to, 3 patients, or they'll tell you what patients, or you can choose the patients that you want. But most of the time, if you choose a patient that has one little diagnosis and nothing not going on, that not going to work out. So you just know you're going to have to find the most complicated patient and start working with those. And they'll tell you, go ahead and choose your 3 patients. And then from there, it's going to be your responsibility to do medication administration. You're going to have a procedure. So every nurse had to do an administration of medication. If you know that the patient has an NG tube, more than likely you're going to have to do that administration via the NG tube for that, as a procedure. If they have a catheter, dressing, whatever it is, you're going to have to do it as a procedure. So you have to do a procedure outside of medication administration. So when you're doing a medication administration, you're talking about going through the rights of medication, telling them about the side effect, telling them about the medication, things like those. And then after that, you're going to have to assess your patient. And you're assessing your patient and you're listening. And you alone and listen. It's not you alone and God listen. Because them have the stethoscope in for them ears and listen too. So it won't listen 2 ways. So if there's anything abnormal that you're hearing, they're hearing it as well. You understand? And of course, Mona, we have to do all the NCLEX again. And then after you do that, so you assess your patient, they're going to say, okay, then we're going to give you some time. And you're going to create your care plan. So you're going to create your care plan on your patients. And a care plan, that's why I say, I don't see anybody doing care plans nowadays. Because when I say to patient, like student nurses, go ahead and create a care plan, and I need a risk diagnosis, I need an actual diagnosis. They might say, huh? Yes, you have to have a risk diagnosis, an actual diagnosis, and a safety diagnosis. So a 9 care plan that you look on. So if you're smart enough from before, like me, what me do is, me create an actual diagnosis that can fit 3/4 the diagnosis them across the board. I create a safety diagnosis that can actually cover a lot of patients across the board. So anytime, so when I go in the exam, I just know that I have my 3 diagnoses working with. You understand? And that's how I did it. And then they will go ahead now and ask you, depending, because a 3 different person, 3 different brain, they will go ahead and ask you, okay, so what's the relationship between hypertension? So the patient have diabetes, hypertension, the patient have a stroke, the patient is also an amputee. You understand? Them go ahead and ask you, because they might confuse you. Not really confused, but I want to see where your head, how you're thinking. They'll go ahead and ask you, okay, so tell me the relationship about hypertension and the stroke. And you have to link the pathophys behind hypertension and how the patient have the stroke. And then you have to tell them a little bit about the stroke. So it wasn't anything like that. Just come in and just look and just, no. They ask you questions regarding what's going on with the diagnosis. And then after you do that, you tell them about your diagnosis. So you'll move away from the patient and then you go over and you talk about your diagnosis for your patient. And you tell them about your risk and your safety diagnosis and all of those things. And then from there, then they tell me to shut up. Because you realize I can't talk. Not true. Yeah, man. I never leave no room for them to say to me, okay, then tell me a little bit about this medication. No, me already reload that long time at the bedside. So anything they're going to ask me, it must be something else outside of what I've told them. So I just practice, practice, practice to be like, okay, I'm Stacy, I'm under the student nurse, and I'm here to give you your medication. This is pantoprazole, and this is for whatever. The side effects are gonna be this and whatever. Done. Move on to the next medication. Me not leave no room for them say, okay, then Stacy, tell me about this medication, aspirin. No, because them are gonna confuse me. I'm already nervous. You understand? So you just give them adequate amount of information. Give them the information that they want. And then from there, they'll say, oh, you already done educate your patient. You already did this. You already done that. And they just move on. So you could have notes. No, dear, where notes are go? You can't have notes. Where are you going with notes? The only notes you have is the paper that we chart on. The patient's notes, definitely. You have the patient's notes because then you're going to hand it to them. Oh, this is the patient. And you tell them. You present your patient just like on a ward round. So if it's the first time... If it's the first time you're meeting the patient, just like when you go on a regular ward round, and sometimes you see the students, because all of the hospitals in Jamaica are teaching hospitals. So you're always presenting patients. You're always, so you see the doctors stand up with them chart looking like this, and the interns, you know, just really know the information. Oh, this is John Doe, 47 years old, came in with this. You have to present the patient to them. And then from there, you tell them what you're going to be doing. So that was it. And after you do that, so after that, you know, let me tell you, a lot of people ball them days there. When you hear that you have regional exam going on, everybody eyes swell up. Yeah, peer tears, everybody are cry. So that's the day you realize who is a nurse and who's strong and who is not. Because some of the persons who are strong in the, you know, the classroom, the aspect, the didactic or the theory, yeah, man, a peer ball in the model. You understand? So it is that time you realize that, okay, then this is what, you know, it's all about. So that's the most nervous-in part about, you know, not the NCLEX, the exam in Jamaica. All right, you have a lot of people just feeling anxious and all about the exam. But yeah. Then after you do that, you have to go now and sit the days of exam. So you have 2 days that you go and sit exam. And as I said, the exam is more of not select all and apply. You have a day of multiple choice and a short answer. Multiple choice and short answer. And then you have essay type question. So they will ask you, like, give you a scenario. And they'll ask you about myocardial infarction. And you talk about myocardial infarction, appendicitis, if that is what you diagnose the patient as having. If you suspect the patient, so they'll give you the scenario. And then if you suspect based on the scenario, if you suspect that the patient is having appendicitis, if the patient is having myocardial infarction, then you start off with that diagnosis. So, you know, if you start off and you diagnose the patient wrong, and you go ahead and give the pathophys, the side effect and intervention and all of those things, you get the entire question wrong. You understand? Because the question wrong, the answer is wrong. You diagnose the patient wrong. So you have to do all of that. And then from there, you know, you wait until they mark the paper and you'll know whether or not you pass or you fail. And then you start working as a nurse when you get your license. All right. And then if you decide to come a foreign, oh Lord, all the bad ways, the bad habits that, you know, you develop because of short staff or no resource, you know, burnout. You have to drop all of those things and then think about the perfect world to study, to do the exam, the NCLEX exam. So you have to relearn certain things. You understand? Because after a while, you know, the habits that you pick up in the working world, you start answering questions based on that. So you have to kind of omit those, erase those out of your memory and try and jump into the real world of NCLEX and do what, you know, you're being taught. So most of the time I spent was on how to answer the NCLEX question. All right, how to answer the question. And as I say, I always have to be telling myself, oh, Stacy, you're not short staff. Like every single question, I have to be telling myself, you're not short staff and you're not alone, because these are the reality of nurses. The ratio is not 1 to 20. The ratio is 1 to 4 or 1 to 1 because it's NCLEX. All right. Yeah, you have all the medication. Nobody not dying over next door, you know. Things like those, you have to just tell yourself so you can actually answer the question properly. Because if not, you're going to see the answer there, you know. The answer that is there is the one that is lighting up the paper, or the computer is the one that is what you're guilty of, the one that you're practicing. So if you say, no, son, that one day, wrong. Move on, next. And then sometimes the answers are so simple. You know, the answers are so simple. We kind of overthink it, I think. Can overthink it, because when you look at the answers, sometimes you're like, oh yeah, simple hand washing, but you're probably thinking about something very, very far away from hand washing, you know. Yeah, so that's just it. All right, Chantal, Ramik, Maggie. All right. Well, what are your thoughts on NCLEX being able to take at home? Well, you know, I love the idea that the NCLEX can be taken from home, because, you know, people from my country, yes, we have to travel this far. Some persons have to go to Mexico to do the NCLEX. You understand? And even though some persons weren't paying for if they were through like a recruiting agency, I love the idea that you can actually take it from home. I'm hoping home is like in other countries as well, like Jamaica. So I love it like that. In terms of, I don't know if persons are going to be honest enough. And I don't know how it's going to be set up, if you have to have like camera on. I mean, I really understand. But anyways, you know, we want to become nurse. So if you want to go there and cheat the system, then, you know, it's up to you. Because at the end of the day, you can have your license and then you come out and it just, you know, you lose it in the blink of an eye. So it's up to you what you'll do. I don't know. But it's okay. I don't have a problem with it. It's just that, you know, if you're going to be fair enough, you know, to sit the exam without peeping, you know, oh, I don't think I'm doing so well, so let me just take a look over that side, you know, things like that. Because as I say, at the end of the day, you'll pass the exam, but you pass the exam and you still can't practice, you know, comfortably when you get into the real world, because you never did it the honest way. So 6 of one, half dozen of the other. So I don't know. But I don't have a problem with it. I'm happy about that. I'm happy about it. Because as I say, you have persons in different places that want to really do the exam. And especially with a lot of persons probably not getting visas right now. But then again, who want to come to America? Well, let me not say that, because, you know, a lot of us want to come to America and work. But in terms of with all of this, you know, with the paperwork, immigration and all, I think it's a big of a turn off right now for some persons. Yeah, so let me not say that. But yeah, I don't think a lot of companies are going to be still recruiting nurses for the US with everything that's going on. What do you think? What do you think about that? What is your take on it regarding immigration, nursing immigration? I know they still need nurses, but do you think it's going to be as, you know, in terms of the amount of persons that they're recruiting, do you think it's going to cut down for nurses, or it's going to be the same? I think it's going to cut down, because I have persons in Jamaica. And usually when I did my NCLEX, or when I applied for my immigration visa, I did it in February of 2016. I got it approved. I paid for it in 2016, February. And September 2016. I'm on a flight out of Jamaica. Now I have friends that is 2 years, 3 years in Jamaica, still waiting to come up and do their, you know, to do that. Like they've done their exam, but they can't get any approval. You know, they're just in like limbo with it. So I think it's gonna cut down. Yes, in Canada it's different. There is a cut down. Okay, I think it's gonna cut down. It's gonna cut down. I see persons in like other places I can't really talk about, you know, for them. But I've seen where some persons are saying that in Kenya, I have a few persons on the live here who are like in Kenya, who says that it has been 4 years and they're kind of reconsidering, you know, whether or not they want to. They still want to come here, you know, because the opportunity. But then they still feel as though they're stuck because they're not able to do certain things. They can't really advance. One person wants to do the anesthesia program. They can't do it because in Kenya, in Africa, you know, you do the program, it's not recognized here in the States. You understand? And then I spoke with another gentleman who is also a nurse and anesthetist who is in the UK, and it was the same thing. He wasn't able to practice with his license in the UK. Now he's here in the States, and he's not able to practice as an anesthetist with his nursing license. So he would have to do over the entire program again in order to practice as a. Okay, yeah. So that is the struggle that a lot of persons are having. That delay is like they're at a standstill. I know it's hard. I know it's hard. Because I tell you, when I did my application, as I say, it's roughly like 6 months or so. And I was kind of feeling, you know, anxious that I was, or probably just feeling depressed at the time. Because I say, oh, why is this taking so long? But to hear about 2 years, 4 years, yeah, that's just a lot. It's hard to get a full-time position. Okay. And I think with, you know, travel nursing as well, being cut down, you have a lot of persons who are back to full-time position. Because if you look at the rates now for travel nursing, it don't really make no sense. Unless you really, you know, really want to travel. For me, it don't really make no sense. Because when I do the maths, not working out. You understand? It makes sense to go ahead and do a full-time job, get all of the benefits with a full-time job. And then from there, just call it a day. You understand? Because if you're looking at the rates for travel nursing, you're thinking about that rate, and then you have your bills at your primary residence, plus you have expenses in the state or wherever you're going to be going. You understand? That you still have to take into consideration. You still don't really save that much. So to me, it don't really make any sense right now. Unless you probably have an RV. And you just, you know, you have a little RV or something, and that is your, you know, mobile home. You don't have an actual house that you're thinking about paying mortgage, rent, or anything like that. Then I would say, okay, then, you know, you could still do that. But I don't think the rates are that good now. And I think it's probably because a lot of persons are going back to bedside because of the same rates. The rates are not there as, like, you know, the time of COVID, where you had really good rates. So I think that is it. A lot of persons are going back to bedside, and so hospitals are not really hiring that much. Yes, and they're not hiring that much because of it. So you'll realize that there's not much job on the market that is actually trickling down to the international nurses for them to say, hey, yeah, we have people up here that definitely need, you know, the extra help. No, them still need the extra help, but it's not that bad in terms of them going overseas to recruit. That's the way I look at it, or I'm seeing it. 8:18. But yeah, but I hope that, you know, things will work out real soon. I hope that things will work out real soon. And at least I want it to be a case where in Jamaica, I'm hoping that, sorry, I'm getting off my bike. I'm hoping that at least in Jamaica, things will, you know, work out a little bit better for the nurses. Yes, I'm just hoping that at least for them, as well as for other places as well, you know, like other places that, you know, it will be a little bit better for them in the meantime. But the standstill, this retrogression thing, you know, look too good for a lot of person. I don't like it. Yeah, so that's just it. Seymour Douglas, welcome. Dr. Liz Nyamburamu. Let me not cuss no bad word right now, because that I cannot call that word. Shelly Marv, welcome. Yeah. God's favorite 7, welcome. All right, so. All right, well, you know, as I say, let me see if I'm here for 30 minutes. Long time, surpassed that. All right, so I am gonna go. I'm tired. It has been a long day. All right, I'm gonna go and get a nap. Probably scroll through TikTok while I'm there. And then from there, oh, it's pretty early though. Yeah, so that's what I'm gonna do. All right, no problem, Jav, and congratulations. Let me make sure that let me see. Congratulations. And as I say, you know, I am here. I am here whenever you're ready to ball. All right. I am here. If you need to talk or if you have any questions, feel free to reach out to me. All right. But it's not going to be that bad. All right. It's not going to be that bad. I'm not saying it's going to be easy, but yeah, nursing school or any program is not easy. What age would you say is a cutoff age to enter nursing? As long as you're not entering and then, you know, you're going to retire after you graduate, like a couple months after you graduate. So I think it's pretty, you know, I would say probably 50. Well, I'd probably say 50, only because you still would want to work for a certain amount of years and still get pension. That's the only thing I would think about. But I don't think if you know, you can go into nursing at any time. Because I see a lady said that she's 54 and she's in nursing school. I may do the calculation to say, okay, then 54 plus 4. You understand? Plus or minus. Sometimes, I'm not saying that we're not clicking at 54 years old, you know. But sometimes I am pretty young. And sometimes my brain never that clicking at university. So plus or minus. Plus or minus, you know, if she is not successful on a course, you know, meaning if you miss one course, if you never pass it, and depending on the program of study and their rules, or the school and their rules, if it's a case where you decide that, if not necessarily decide, if it's a case where you fail an exam and or a course and you have to sit out for a year, because my program in Jamaica was like that. If you fail any course, because the course was only offered like once a year, so if you fail any course, you know, you have you drop back 1 year behind. That was just how it is. So I don't know if it's like that in the States here, but I'm just saying. So that's what I'm saying. If you are at 50 and you'd go ahead and do the course, you know, at least you still have years that you can work and then hopefully, you know, for pension, because a lot of persons are looking for that. But as I see Stacey here says I don't think there is a cutoff as long as you have a passion. Yeah, I totally understand that. You can always, you know, do any program. But I think if they're going to be doing it, a lot of persons are doing it with the hope that they're going to be going to bedside to help. I don't think they're going to do the course and then just go home and sit down and look on the degree. Yeah, at least I don't think so. Unless, you know, you have some persons who definitely wanted to become a nurse, or they wanted to get a certification or whatever it is. And even if they're not working, at least they accomplish something. If that's the case, then that's different. You understand? But I just think that a lot of persons would be wanting to do the certification or the program and then be working. So it depends on, you know, what their dream is. Unbothered Julie reacts. Have a good night. Hi, Julie. How are you doing? Zarian. Yeah, so that's just it. All right, but there's not really a cutoff period. All right, you can always enroll, you know, in any program of study once you are, you know, open to it. And that's just it. All right, thank you guys for tuning in on YT here. Oh, remember to go ahead and follow me on YT at ThinkNursing. You can also follow me on TikTok at ThinkNursing as well. All right, been listening. I applaud all nurses. Okay, thank you for that. Thank you for that joyful, unbothered, joyful Julie. Julie. All right, Floyd Harrison, welcome. But yeah, so that's just it. That's just it. Anyways, my eyes are closing down. I need to go and, you know, take a nap. And then from there, I'm going to drink some tea. I feel like I have gas. Yeah, my head will hurt me. I drink mint tea. Hey, I brought up some dried mint in brown paper bag from Jamaica. It still smells good and it still tastes good. Yeah, tastes like mint. I'm going to show you. Yeah, that's my mint tea. It's kind of cold now though, so I need to warm it back up. Yeah, so that's my bush tea. That's my mint tea. Alright. Anyways, the only thing that is missing is probably some tough crackers. You know what tough crackers mean? You know what? Where name again? What the cracker's name again? Who is here from Jamaica? What the cracker's name? I'm in the red bag and they have it in cinnamon. What a biscuit the name? A tough crackers we call it. What the name? Excelsior. Oh my word. Yeah. Missing the Excelsior crackers. So I can dip it in it and then eat them when them soft. My word. I miss that. But anyways. The cinnamon one, yes. Either one of them should be fine, you know. Any one of them I get right about now, I'll drop it right in the cup. I am not gonna lie. Any one I get right now, I'm gonna drop it right in the cup. But I'm gonna have any. And the other one that I miss is Miss Birdie. I haven't had Miss Birdie biscuit in like for years. I used to have it in college with goodness, cornflakes and Lasco. Yeah, man. I used to be studying in bed with my Miss Birdie crackers in the brown bag and my cornflakes. I used to crush it up in the cornflakes. So I used to mushy. Oh Lord. Oh, you like the golden crackers? Okay. Okay, nice. Yeah. So I miss those. I miss those. Yeah. So like when I go down, I try to see if I can find those, but sometimes I can't find it. I think one year I brought up the Miss Birdie. But you know, so by the time Miss Birdie reach up here, Miss Birdie crush out. The only thing I could do is mix up, you know, that side. Mix some Lasco and just put it in there. You understand? And drink it because I couldn't let my biscuit go to waste. I couldn't let my biscuit go to waste. And so yeah, I don't pick up any more Miss Birdie and bring it up because by the time they finish through the suitcase left, right, and center, everything means out, crush out. You understand? So that's just it. Alright, enough of talking food. When last night you know patty? Need a patty. Oh my word. I've been singing on patty from the other day. Got some the other day from I think a Sam's or Costco, one of them. I got it from, but yeah, I need some real beef patty right about now with some cheese in it. Yeah. Juicy or tasty. Any one of them, my dear. Anyone I get, I will sit down and enjoy it. Me not lying, except Mother's. No, Mother's patty. The last time I went down and buy a Mother's patty and it never tastes good. I think it was the last one on the shelf. But I was so hungry. I just say, you know what, let me just take it because it was late. I said, let me just take it. And the patty was so salty. I said, no, sir. Why did I do this to myself? Mess up my taste bud for the rest of the night. It was so salty, but either one should be fine. But I actually love juicy patty though. I love juicy patty, not going to lie. So every time I go to Jamaica, that's the first place I stop. I can't wait to come off of the plane. I can't wait to come off of the plane and drive into a Trelawney. I don't even know if a Trelawney, because most of the time I come in from Montego Bay, because when I go for I always go Montego Bay because I like direct flights, because I just feel like I can't stay. I don't want to spend 8 hours flying to Jamaica, and the flight's supposed to be like what, 3.5 hours, 4 hours. No, sir. I'm always wanting to just touch down, just ready to touch down. So I'll go Montego Bay and then I'll drive. I don't go in Montego Bay town. I'll just drive until I see the juicy patty on the right side. I don't know, I don't know where that is. I think it's probably in Trelawney. I think it's in Trelawney. So you know how long I have to sit and wait for the little patty. And then I just drive up there, sit down and eat my 2 patty. And then brush off my mouth. Because if you eat the patty and your mouth don't full of the crust, you're not a Jamaican. You're not a Jamaican if you eat the patty and your mouth not full of the crust. And then the patty is hot as well. Yeah, man, the patty is hot, so you have to blow on it. Oh my word. Or you look and you realize that the entire cheese and the patty squeezing out in the bag. Oh Lord. Yeah, so I miss that with my big Joe. Oh goodness. Yeah. They're very expensive at the airport. I don't really like that one. I don't really get the taste from me I look for. I don't get the taste from the airport patty, honestly. So I don't really stick around with that one. I'll buy it when I am coming up if I feel as though I have space for more. But no, most of the time I'll order it from the juicy beef and then bring them up. But yeah, sorry and get off my bike. But I miss it. So when I go to Jamaica, that's what I'm always eating patty. I'm always eating patty and cocoa bread. And then when I get into Clarendon, I have to stop at Clarendon Park. The juicy patty down there and get ackee and saltfish in the mornings. Yeah, I have to get my ackee and saltfish in the morning. Hi, Dennis Malcolm. Yeah, because I love ackee and saltfish. And they always have ackee and saltfish down there. If I go through Spanish Town and there's none, and I'm not the kind of person, I always just, when I was growing up, they always say don't eat ackee from strangers because it might poison you. Just because, some persons don't open it in time and they force open it and all of those things you hear. But ever since I come to America, I eat tin ackee. You understand? And I never dreamt of eating tin ackee. I love ackee and I try it out and I'm alive. Since 2016, I'm still alive and well. So, I'm still gonna be eating my Linstead ackee. Yeah. But when I go to Jamaica, I try to get ackee prepared. Them in the fridge down in Jamaica wait for me. So I'll bring them up in small parcels and then just drop them in my deep freeze. So that way I always have ackee throughout the year. Yeah, so because one tin of Linstead ackee is probably like $19, almost $20. Let's do the maths. One tin that and when I am eating one tin of ackee, when I'm eating one ackee, it's not much ackee in the tin. The tin is like so small. So by the time you don't fry up that with your little saltfish, it's only one serving. It's not much ackee in the tin. So let me see. So $20. How much for a US dollar now, Jamaica? Let's say a US dollar is probably, I don't even know, about 140, 150. I'm gonna put it at 150. I think it's probably more than that. I don't know. So that's roughly $3,000 for one tin of ackee. Wow, in Boston it's $10. No dear. I see where it's $19. I used to buy it for $15, $16. And then ackee have to stretch turn into it. Ackee. Oh Lord. 160. Oh, so 160. No, okay. Yeah, man. So yeah, buy one tin of ackee for $3,200. Usually mother go around at the back of the house and go climb ackee tree and pick ackee. You understand? Or go underneath the tree and look up and smile so you can hurry and open. Now me I end up eating ackee. You ever hear anything like that yet? No, sir. That's why I tell you say I miss home. I miss home so bad. But I'm not going to complain because I don't want anybody to say where you come a foreign for if you go and miss all of them stuff there. In America, when you see ackee, you are going to be like, I can't. Okay. Yeah, when I go there, I take off all of the ackee off of the shelf. I take off all, because sometimes we only have 3 tins. In the little store, then we have 3 tins. I'm not leaving anything that says Jamaica. You understand? Once it have the little flag on it, I take up the 3 little ackee, the 3 little callaloo. Even though the tin callaloo not taste good, it have a lot of bone. It feels like bone. I don't know. When I'm chewing it, I don't know what I'm chewing on. I don't think it's even real callaloo. I don't think it's real callaloo. But anyways, I still eat it. You understand? Because it's green and a bush. Yeah. So at least I can still be vegetarian. But I don't think it's callaloo. It tastes like callaloo. It kind of just feel like, it's just tough. It's hard. Yeah. So, but that's just it. But anything that has a Jamaican sign on it, a Jamaican flag, yeah, man, I pick it up. Because when I go back there the next time, I'm not seeing any. Sometimes you go there and a long time I eat white bread. I don't really eat white bread for years. And when I see one hard dough bread on the counter, me I take it up too. I take it out because then I'm gonna come home and make Milo and cut the bread and dip it in there and sit down and eat it. You understand? I feel like me there Jamaica again. But I take up everything off of the shelf because I'm not putting out much. They'll probably put out 2 little spice bun. You probably want. I don't pick up the cheese. I leave the cheese because I can't cut the cheese. The cheese in a little tin. No, too much cheese in a Walmart. But the 2 little spice bun, they'll put out 2 little jerk sauce, 2 little browning. We take off everything off of the shelf. You understand? Because before because the next time I probably go there, there's nothing there for me. You understand? Me need browning, can't find browning. I got browning the other day, and the only thing I wanted was, how many persons know about, burning sugar? But the only thing I think about is probably people them alarm, is gonna start whistling. You understand? So I said, no, sir, we're not going to do that. We're not gonna do that. And someone said, no, sir, we're not going to do that the other time because I never wanted the alarm or anything to go off because I can't bother with it. You understand? So I was like, at one point, no, we need browning, and I was thinking about burning some sugar to get some real browning, because the browning that I get, it never did I do anything for the chicken. It never did I do anything for the chicken, and the chicken come out looking white. And finally, someone told me about a different kind of browning, and I was like, okay then. And since then, I've been using that one. But anytime I go and I see browning, I'm always just picking up. I'm always picking up the browning because I don't want it to be, I only use burnt sugar works well. Oh, a long time I don't see that. As I say, I was thinking about it at one point when I just come here because me couldn't find no browning. I couldn't find a browning to use because everything cook and it just cook and look white. You understand? Or I had to mix it with curry. I had to mix it with curry so it could actually get a different color. And then when I mix it with the curry never come out like curry because it never have no color. So every pot is spoil. So when I go to Jamaica, I just make sure me bring up my better pack. Me go and look for my better pack and bring them up so that way I can have, decades of curry. And I can have my different browning. Wrap up my browning in a newspaper and bring it up and pray that it not break in the bag. You understand? In the suitcase. So I pray that it don't break in the suitcase by the time them finish throw it around. Yeah, but so far it hasn't. And I found browning and I've been using, it's not Eve browning I have. I don't know what the brand I've been getting for a while now. When I just come here, it was so hard. I was so tempted to start burning my own browning. But yeah. But I found one that is really, really good. And I've used it once or 2 times. About 2 times I've been using it. And then, because I'd ordered it online. And then from there. All right, I think we had said that I was gonna go now, so anyways, yeah, I'm really gonna go now. It's 8:38. It's bedtime, past my bedtime in a sense. I'm trying to go to my bed early. At least that's what I say, but yeah, I'm trying to go to my bed early, and then from there, all right. But it was nice chit-chatting with you guys. Come back tomorrow. All right, we can have another, tomorrow is what, Thursday? Oh, we're gonna do nursing live tomorrow. Just hope the folks don't sleep on me tomorrow because I realize they've been very sleepy, which means they're boring. You know them way there? No, you can't come in front of my thing there. Give me this. Yeah, so the other day, yeah, so some of my followers, they were sleeping while I was doing the question. I don't know if the system that we were covering that was boring. And yeah, they weren't answering the question as how they would normally answer the question. I don't know if they drop asleep or what, but but go ahead and follow me on YT, folks. All right, follow me on YT at ThinkNursing and also on TikTok at ThinkNursing. All right, and you can always shoot any question. Well, send me any question. All right, send any question over to me and I'll answer them. All right, you can DM me and I'll answer them as well. And yeah, it's a good vibe. Anyways, enjoy your evening. Sam Slams, welcome. And thank you for the follow. Who is this? Oh, Sam. Thank you for the follow. All right. Cute Katie. All right. Jessie Delise. Hi. How are you? I'm doing fine. I'm fine. Dark, welcome. Thank you for... Oh, remember to go ahead and do the heart me. All right. Is this heart? You're going to have to touch on it today, daily heart me. Thank you, Jessie. Thank you. All right, and thank you for sharing the live, Game Changer. I appreciate that. All right. Jessie, how are you doing? Jessie always come and say the same thing every night, you know, every single night. Jessie come and say the same thing. Eh? All right, Jessie. Where are you from, Jessie? Where are you from? Thank you for the follow, Dark. Okay. Okay. All right. Nice, nice. But where are you from? Where are you joining me from? Oh, you're from Trinidad. Okay. Okay, nice. Okay, so we're neighbors then. We're family. We're neighbors. Angela, how are you doing? You come on when I leave. Yeah. You're coming on when I'm leaving. Good night. How are you? How your day went? Yeah, man, I kind of cut the live. Okay, nice. All right, then. Well, I know we're still here. I'm going to go. Well, enjoy your night. All right, and I will see you guys tomorrow. And as I say, tell your friends about the live stream at 7 p.m. It's Central Standard Time. So it's 8:42 now here. All right, it's 8:42. So tomorrow around this time again, well, after 7 o'clock tomorrow, we will do another live, and that's 7 p.m. You like my hairstyle? Thank you. Thank you. All right, and then from there, yeah, we'll have a wonderful time. It's gonna be good. I'll create some nice questions for the live. All right, until then, I will see you. All right, bye. Thank you for tuning in. And remember to go ahead and follow. All right, Jessie, and the others. All right, bye.